Laser applications and safety practices place increasing demands on the perioperative nurse and team members as they implement the intraoperative phase of patient care. The Association of Operating Room Nurses is therefore pleased to present this continuing educational activity entitled Lasers in the Operating Room. The American National Standards Institute defines a healthcare laser system as an apparatus that includes the unit, delivery system, power supply with control and calibration functions, mechanical housing with interlocks, and the fluids and gases required for the operation of the laser. The application potentials are endless. Every surgical specialty has studied the various wavelengths and their applications to tissue. There are 4 possible interactions between laser energy and tissue. The energy is absorbed, reflected, scattered, or transmitted through the tissue. The primary reaction depends on the wavelength generated and the absorption properties of the tissue with which it interacts. The tissue responses to beam interaction are thermal, photodisruptive, or photochemical. Approximately 80% of the lasers used in surgery create some thermal effect. Out of over 1,000 different mediums developed to create laser energy, only about a dozen laser systems are used for everyday clinical applications in healthcare. When handled properly, healthcare laser systems are safe and effective. However, never underestimate the potential danger these powerful, intricate, and technically demanding surgical devices pose. Serious injury can result if settings are not properly controlled, protocols per wavelength not observed, or if the laser beam is inadvertently aimed incorrectly. Perioperative nurses should be familiar with unique features, operational aspects, and safety practices applicable to all lasers. The wavelength of the laser determines its unique tissue effect and dictates what safety measures are necessary. AORN's recommended practices for laser safety in the practice setting advocate controlled access to areas of laser use and identification of nominal hazard zones. The safest practice related to the measurement of nominal hazard zones might be to consider the room in which the laser application is occurring to be the zone of hazard for everyone. Laser energy is usually contained within a room unless open doors or transparent windows exist, and the wavelength being used is capable of traveling through these openings. Regulation signs should be placed on all entrances to the laser treatment areas. Window covering should be appropriate to the laser wavelength being used. For example, the glass of a window will stop the CO2 wavelength. However, it will not stop the argon or YAG beams and should be covered for those wavelengths. The eye is extremely sensitive to laser energy. Following the standards and recommended practices is critical to the safety of personnel and patients. Protective eyewear may include goggles or face shields. Prescriptive glasses may be worn if they were manufactured by a laser goggle manufacturer and coded for a specific wavelength. Be sure the sides are protected from beam entry. The eyewear should be labeled with the wavelength for which protection is provided and the optical density. Clean and inspect the eyewear routinely. Do not clean the absorbing or reflecting surface with chemicals or abrasive cleaners, as this will damage the lens. Look for pitting, cracking, and scratches, and inspect for light leakage that could permit intra-beam viewing. The patient's eyes and eyelids should be protected from accidental beam exposure. Keep in mind that patient education equals compliance of the awake patient. Conscious patients can wear the same protection the team is wearing. The sedated or anesthetized patient's eyes should be protected with wet pads taped in place or laser-specific eye shields if the procedure is on or around the eyes. When using the laser through a microscope or endoscope, appropriate eye protection is also required. Fiber optics can break at any point in the system, creating a hazardous situation for those in the room without protection. Each laser wavelength affects the eye differently, resulting in specific types of eye damage. Ultraviolet lasers exert a photochemical effect on the cornea and lens, causing scarring and cataracts, while the CO2 burns the cornea and sclera. The argon, krypton, dye, and YAG lasers damage the retina. Engineering controls that reduce the possibility of plume inhalation include wearing high filtration efficiency masks and using smoke and plume evacuator systems. Tests have identified over 80 different chemicals and components of plume, depending on the energy source and the materials being heated. Poisons, toxins, carcinogens, bacteria, and viruses are some of the more hazardous content. To use the smoke evacuation wand effectively, place it as close as possible to the site of plume origin. High filtration masks help filter particulate matter and may reduce noxious odors. These masks should not be viewed as absolute protection from laser plume components and must be used according to the manufacturer's instructions. Smoke evacuation systems are used by healthcare providers as the first line of protection against occupational exposure to laser-generated airborne contaminants. A smoke evacuator is a vacuum pump with a filtering system. Filters vary from brand to brand. The efficiency ratings are important. HEPA is rated at 99.97%, whereas ULPA and VLSI filters have a much higher efficiency rating. Carbon filters are used primarily to control odor. Filters should be changed according to the manufacturer's instructions. They are to be treated as contaminated material and disposed of accordingly. Be sure to wear a mask, gown, and gloves when handling used filters. Patients should also be protected from possible smoke inhalation. The production of smoke within the closed space of a cavity can be hazardous to patients. Studies show that patients demonstrate changes in normal hemoglobin due to cavity smoke absorption. Fires can cause considerable harm to patients and personnel. Fire prevention is a major priority. The thermal laser beam is a powerful ignition source for the triad of a fire, and potential fuel sources are everywhere in an operating room. Items with the greatest potential for becoming fuel are flammable liquids or combustible ointments, gases, plastics, drapes, sponges, and endotracheal tubes. The presence of high oxygen concentrations add to the risk of fire or explosion and lead to the rapid spread of flames. To prevent a laser-related fire, follow these safety guidelines. Turn the laser to standby when not in immediate use. Use instruments with surfaces that reduce specular reflection. Avoid flammable anesthetics, prep solutions, drying agents, or ointments, and decrease oxygen concentration. Have a basin of sterile water or saline available on the field. Use flame retardant drapes or moistened reusable fabrics around the areas that are close to the laser treatment site. Never place hot fiber optic devices on surgical drapes or dry towels. Keep fire extinguishers immediately available when lasers are used. An endotracheal tube used during laser procedures in the patient's airway or aerodigestive tract should be specifically designed to minimize the potential for fire. Standard endotracheal tubes are combustible and should not be used for these procedures. Lasers are high-powered electrical devices and carry the same risks as any other electrical equipment. Always check the wiring, cords, and water hoses if applicable. Never use the laser console as a prep stand or supply table, and do not handle the equipment with wet hands or near fluids that may be on the floor. Maintain a regular schedule of preventive maintenance and keep a written record of all services and repairs. Unplug the laser when it is not in use and remove the key. Immediately discontinue using the laser if it malfunctions and call service personnel. Detailed training in laser safety is the best preventative measure to ensure program controls. Laser safety officers and laser committees are responsible for creating and implementing policies and procedures that protect patients and personnel. Laser technology has opened new doors to less invasive surgery and has enabled surgeons access to pathology not before reached. The perioperative nurse manages patient and personnel safety during the application of this important surgical technology by observing recommended practices, applying laser safety knowledge, and maintaining vigilance during each patient application of laser energy.